Aye.
Is there someone who would like to read the land acknowledgement today? Anybody? Nobody? Okay. I will read the land acknowledgement. If you ever want to, please let myself or Michaela or Kelly or somebody know. Welcome, everybody. We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land with the Warm Springs, Wasco, Northern Paiute, Tenino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children. Are we going to, we are still verbally introducing ourselves, yeah? Yeah, okay. Camille, are you with us? Camille, are you gonna help us with that, or is Kelly?
I'll help with that. We'll start with our CAC members. So we'll start with Brad and then Elaine.
Hi, everyone. Brad Porterfield, Consumer Representative, CAC Chair. I'm also the Director of the Latino Community Association.
Hello, everyone. Elaine Nabsey-Schultz, CAC Community Member, Mosaic Medical Director of Strategy and Development.
Next, we'll have Elizabeth and then Mandy. Elizabeth, are you there? We might have to come back to her. Let's do Mandy and then Regina.
Hi everyone, Mandy Seeley. I use she, they pronouns. I am a CAC consumer rep in Sisters.
Hello, Regina Sanchez, CAC member, Cook County Health Department.
Next, Stacy and then Tom.
Hi, my name's Stacy. I'm a new CAC member. I live in Redmond and I'm also a student. Hi.
Hi, Tom Kuhn, Deschutes County Public Health Representative.
Great, and then we'll have Teresa, who just joined us, and then Miranda Hill.
I'm Teresa Olander. I'm a community representative. Hello.
Morning, everyone. My name is Miranda Hill, and I am a new CAC representative for Klamath County Public Health.
Excellent. That is all of our CAC members, I believe. Next, we'll go to our COHC Health Council staff. Let's start with Michaela.
Hello, everyone. Michaela Arsenault. My pronouns are she, her, and hers. And I am a CAC co-coordinator with Gwen. So I support the work of the CAC and help move projects along, things like that. Welcome.
Sorry, Donna and then Gwen.
Hi, everybody. My name is Donna Mills. My pronouns are she, her, and hers. I serve as the executive director of the Central Oregon Health Council, which indicates that most of my work is done around supporting the staff so they can support you. Good to see you.
Hi, I'm Gwen Jones, she, her, hers. I'm a project manager as well, partnering with Michaela to help support you. So I contribute to helping organize the agenda, structure and facilitate conversations, follow up with emails and such like that. So glad to have you.
Next, we'll do Renee and then Camille.
Hi everyone, Renee Worth, she, her, and hers, and I'm a project manager with the Central Oregon Health Council.
Hi, everybody. I'm Camille Smith, and I am the administrative assistant at the Central Oregon Health Council.
And then I'm the last person for the Health Council, Kelly Adams, she, her, hers, admin services, helping out Michaela and Gwen with the CAC. Let's move to Kristen and then Rebecca.
Hi, I'm Kristen Tobias, and I am the Community Health Coordinator for Pacific Source here in Central Oregon. And I use she, her pronouns.
Hi, Kelly. Me, Rebecca Donnell. Do you want me to go?
Yes, please.
Okay. All right. Hi, I'm Rebecca Donnell. I'm an innovator agent with the Oregon Health Authority, serving this region, the CAC and the Pacific Source CCO. And pronouns are she, her, hers. Thank you.
Great. And then we have Carolyn and Trisha.
Hello, Carolyn Black, Outreach and Education Coordinator with the Oregon Health Insurance Marketplace, serving Central Oregon, and I use she, her pronouns.
Hello, everyone. I'm Trish Wilder. I'm the Director of the Coordinated Care Organization, the CCO. We partner with the Central Oregon Health Council, and I'm here to support both Pacific Source and the Health Council.
Great. Elizabeth, are you there?
I'm here. Can you hear me?
We can now. Could you introduce yourself?
Okay. This is Elizabeth Schmidt. I'm a consumer rep, and good afternoon. Thanks.
Excellent. I believe I got anybody. Did I miss anyone? Great.
All right. Thanks, Kelly. And we definitely want to welcome our newest CAC members, Stacy Shaw. Welcome, Stacy. And Miranda Hill. I want to give each of you a minute to, if you want to say anything, either just about yourself or how you feel about being a brand new CAC member. Stacy, if you want to say anything, go for it. You don't have to, but if you'd like to.
Last time I spoke, I had said I was an engineering major, but I had recently changed my degree to a master's in biostatistics and epidemiology in the public health sector. Pretty excited about it because it'll take me the same amount of time to get a master's than the bachelor's in engineering. And I definitely am more passionate about social science, it seems like, than engineering.
Good. Congratulations. And Miranda.
Yeah, good morning, everyone. Like I said, I'm Miranda Hill with Klamath County Public Health. I am newer to Oregon. I moved from California last year. So we have a lot of snow here today. So I'm definitely getting used to that, but I love Oregon. I have a beautiful Australian Shepherd. He last night was just playing in the snow. So I'm happy to be here with all of you, and hopefully I can contribute something. Here at Public Health, I am the overdose prevention and tobacco prevention coordinator. So if you guys ever need anything, I'm here.
Great. Thank you. Welcome. All right. So now we're going to have Donna give us an update on the CAC and board combined actions.
I am? No. I actually was, hi everybody, it's Dawn again. I was actually looking for my email that I sent out, and I'm hoping that you members of the CAC actually received it. You'll get another one. But I was making an announcement that on January 13th, we hope to continue the work that the CAC and board started together back in September. and really looking at what you had prioritized around actually bringing patient consumer voices to the board, of which you've accomplished. We've done that 2 months in a row, and thank you so much. The board, I want to say that they're really excited about it, but they're really excited about not the fact that there are issues, but the fact that issues are being brought to them that they can speak to and remedy. I think their hearts are really kind of full that they actually get to be a piece and a part of that. So keep those stories coming. And please, let us know if you that have submitted stories really feel like that you didn't get resolution, because we really want to know that. And I know that they really want to know that. So thank you for that. The other item that actually you had top two that were for the top first place about what was important to you following the September meeting. And that was to continue to build relationship with the board. And the way that it had been outlined, as you said, maybe every 3 to 6 months we could get together and continue to build our relationship. So we're going to do just that in January. So on January 13th, we'll have a Zoom meeting, much more to follow around how frequently you want to meet, what questions should we be helping you facilitate. And this particular time, we're going to use a meeting that was already established. But again, that's so that we can have the opportunity to really hear from you and the board about what might work for you. So January 13th, save the date. I'll have some more information coming out. And for anybody that's new and doesn't know what I'm talking about, I don't want to take up your whole meeting. So I'm happy to talk to you offline, and I am really easy to find. So thanks, Brad, for giving me a minute.
Thanks, Donna. Yeah, and just to rewind, very briefly, we had a combined, in the past, there's been one annual combined meeting between the board of directors of the Health Council and the Community Advisory Council to the Health Council. And CAC members expressed and board members agreed that it would be better for us all to meet together more than once a year, just to kind of build relationships, have better communication. And so that's the progress that we're in the midst of making. So we met in September, and this will now be meeting January 13th. So thanks, Donna. All right, public comment and patient stories. So first, is there any public comment? This is a time to say anything really relevant to the work of the Community Advisory Council. I think that can be pretty broad, health system related, Medicaid related, OHP, Oregon Health Plan. Okay, if there's no one with a public comment, then we'll go to the patient story. Regina, would you like to read your patient story? Or yeah. It's as much public comment as it is patient story.
Okay. One of the challenges that we're seeing with our WIC participants on OHP is that they can't get their toddlers in to see the dentist. It's kind of weird reading something that I wrote. We have had clients try to get their child seen at Advantage Dental in Prineville. They will not see them. They will not even schedule them that young. If they are not staffed to see children that young, we need to see what we can do to get these children assigned to a pediatrician dentist. We also see that parents find it very hard to figure out what provider they are assigned to. Not sure how that happens because it's on the front of the card, but they do struggle. I have a client that, had been trying to get a referral approved by OHP to get their child in for an oral surgery. This child has been in pain for several months. And in the meanwhile, when this referral is going back and forth with whatever loops need to be closed or appointments that need to be scheduled, this child's mouth is becoming worse and more painful. We need to see an easier way to get these types of situations handled. It is challenging for our community health workers to navigate these situations for our clients. I can't imagine how someone trying to navigate this and not knowing even where to start. So
Thank you, Regina.
Very
And you
common issue.
say common?
Yeah.
Yeah. Yeah, so I had the honor of carrying this forward to the board and reading this to the board of directors of the Health Council. And so thank you for providing this. And there was definitely interest and concern, and there will be follow-up. And so we can get more, provide you with more information by the time we meet next time, if you don't hear from somebody in the meantime, but what that follow-up looks like. So thanks, Regina.
Thank you.
And everybody is encouraged, CAC members, you're encouraged to bring these kinds of stories forward. Again, they don't always have to be pointing out problems with the system, but the culture, and correct me if I'm wrong, Donna or whoever, but I think the culture of the board of directors in particular previously was to share kind of positive patient stories, that's awesome. I think that's fantastic. But at the same time, if we're seeing problems and we're trying to improve our health system, this really is the work we need to be doing. We can pat ourselves on the back at other times. That's Donna's shaking her head. Yes. Okay. So thanks again, Regina. And again, anybody on the CAC can bring these stories forward, and they can be stories you've heard from other people. They could be first-person stories, your own experience. All of that is welcome. All right. And Teresa, your story that you brought forward, there's been quite a bit of progress, I think, but we would, of course, like to hear from you if, from your perspective, you're seeing progress.
Kind of, sort of, and kind of, I don't know. We'll find out over the next year. So on a personal level, out of the blue, I ended up with an advocate who is basically working for me, and she's on it. What they've done is, since I've been switched around, as you know, through every dental what are they called? Dental DCOs that there are in Central Oregon, and now I'm in an advantage. Based on what the people at the top feel in my circumstances, they've decided to send me to Sisters, which is okay. I mean, I like Sisters, but it's not a 10-minute drive, but that's okay, because they're saying the dentist there has been long-term and very good and very compassionate. And they did have me assign one in Ben, and he apparently has gone to teledentistry. So I lost him, and I got assigned somebody who was literally right out of school, which didn't make me, I'm not against young people. It depends on what they're doing. But this guy is the age of my children. But I saw him to just get some grinding down on a broken tooth I had. And he was okay, but I'm glad I'm not going to him long term. And I also feel like finally I've been heard and I have somebody behind me. So that's been good. I do feel like sometimes we're told what people think we want to hear. Like the email from Gary was nice, but it felt like a no answer to me. And that could be just the way I react. It's like, here we have these issues, but this is, I'd have to pull it up and go through it again. But there were some things in that upset me. And first of all, like, I'll just throw out really quickly, like, well, it's been like this for 22 years. Well, my first response to that is, if it's been like this for 22 years, then you have a really broken system and you need to fix it, But my other question is, I feel like I'm so grateful for the help I've gotten. Please know that. But also I feel like sometimes it's just a bandage for the whole big picture. And I really would like to know why dentists don't work with OHP patients. Why they don't want to? And like with Regina, I would like to know, So in the private sector, because I don't remember, what age do toddlers usually or children usually start seeing a dentist? It sounds like some of her kids, some of the kids need beyond just basic dental prevention care. So, and then why don't we have a pediatric dentist for OHP people? See, it's just, it's these big looming questions of, I know there's answers and I know people know, but they're not telling us, which I think doesn't help solve the problem and doesn't help customers, patients, clients feel like the system is going to take care of them and feel trusting and feel like it's competent. So, and those just spiraled down, I think.
Yeah, thank you, Teresa. Regina, if you wanted to, sorry.
Yeah.
Go on.
If you want to just respond real quickly, and then we are going to talk a little bit more about this at the very end with Rebecca and Kristen, but go for it. Go for it.
Yeah, and we could talk about it a little bit later. I just kind of want to back up a little bit. There are pediatrician dentists. What happens is sometimes they're just not assigned to the right person. And so if they don't know how to navigate it, they don't know where to start. And the recommendation for WIC is once they start, they start showing teeth, they would like them to start getting them checked out because they tend to suck on, they still have their bottle, they drink lots of milk, their parents put them down for bed with milk and things like that. And so they do develop dental issues if they're, if they're not looked at right away. So
okay,
I think it's more navigation, and it's just a hard thing to navigate.
So we need like a grant application for somebody to teach parents how to navigate the system from WIC. Throw that out for next year.
Thanks, Teresa and Regina. Yeah, so Regina's, I'm assuming we're going to move Regina's, the issues she has raised into our emerging issues process and start moving that along. So, and then we'll talk about some of this more at the end with Rebecca and Kristen. All right, last bit of business here is to did everybody get a chance to look at our meeting notes from October and November? And are there any questions, comments, or yes, Teresa?
Are you allowed to approve minutes if you weren't at that meeting?
Yeah, that's a good question. Donna, I see you moving.
You may not motion to have them approved, but you certainly can vote to approve them.
Okay, thank you.
Thanks, Donna. And Teresa. So any questions? There are a couple of action items. The two that I noticed, I think from November, we're going to be they'll be addressed with Rebecca and Kristen at the end of the meeting. Our last agenda item. Is there anything else? And if not, would someone like to motion to approve the notes from October, November?
And if I remember, Brad, we were kind of going more informal with is there somebody that, this is accurate and getting consensus around accuracy versus a formal motion because they're for inclusivity and understanding the process.
Okay.
Yeah.
And then we'll just vote on if there aren't any.
Yeah. Let's we're all in raise hands if you're in agreement to what you see.
Gotcha. Thank you. Yeah, so if there's no discussion, no questions, none of that, please let us know if you would like to vote to approve the notes. Just say, yes, the notes are accurate from our last two meetings.
How do we do that? Just
You can raise your hand, you can say yes.
yes.
I approve. 1, 2, yes. All right, I think we're good. Thanks, everybody. All right, we're now moving into some time, a breakout session where we connect with each other, get to know each other for 5 or 10 minutes, 10 minutes, and connect on a level that's not in this big group. So we're going to go into breakout groups, yes? Smaller breakout groups?
Yes, I'll send everybody to breakout. And just a reminder, the question that you can discuss today is, do you have any holiday traditions and how do you celebrate them?
Is everybody still enjoying the 10 minutes we take to get to know each other? Thumbs up? Yes, thumbs up, head nods. All right, I love it. Okay, so we are going to select our co-chair, vice chair, what do we call it? Vice chair, co-chair, same thing. Somebody who's going to support me and work with me and work with the staff. Just to kind of keep these meetings in line, to look at each month, look at the next month's agenda, maybe next 2 months' agendas, and kind of keep us on track and so on and so forth. So we have a question. We have, how many nominees do we have?
3.
Three nominees, and currently there's the roles and responsibilities has like a stipulation about the where is it? Yeah, so thank you, whoever's doing that. Must be receiving to be vice chair or chair, must be receiving benefits from Pacific Source Community Solutions Oregon Health Plan, or be a guardian of dependent currently receiving benefits. So apparently there's like a technicality where there's something called the open card, and we have Kristen with us to explain what that is. But apparently we need to specify it in here if we want to include people who have open card, because it's not technically considered. Kristen, we explain it.
Sure. So OHP is sort of managed in 2 different ways. So there are people who are enrolled in a CCO, or a coordinated care organization, which is what Pacific Source is. So in Central Oregon, the state gives us a dollar amount, and we manage the Medicaid benefits for people enrolled in our CCO with that money. And we do that with contracts with providers and payment plan or payment, scales and things like that. Then there's this other part of OHP, which we call open card or fee for service. And these are people who are not enrolled in a CCO. They're typically either Native American or Alaskan Native, or folks who maybe are really moving around the state quite a bit. So it's like they don't have like a permanent address to enroll them in a CCO. CCOs are assigned by zip code. The other category where you might see somebody with an open card or fee for service is if they have Medicare as their primary insurance. And then they might have secondary insurance, which would be Medicaid. Medicaid or OHP is always the payer of last resort. So somebody that qualifies for Medi-Medi or dual eligible, their Medicare plan would pay for any medical services first, and whatever Medicare doesn't pay for, Medicaid would then pay for. So where we run into some things here with the Community Advisory Council is that the CAC is the advisory board for the Central Oregon Health Council's board of director. So you guys work as a consumer advisory board or consumer advisory council to our board. So Brad and Linda Johnson bring your stories and share your feedback with the board, and then the board advises Pacific Source. So when we have an open card or a fee for service member, they're working directly with the state and not with the CCO. So they just have a different experience with how their OHP benefits are being managed and administered. So like anybody in the CCO can call Pacific Source and reach a customer service agent in 60 seconds or less. Somebody with open card or fee for service would have to call the state and might sit on hold for 45 minutes. That's our claim to fame, our short customer service time, hold time.
All right, thanks, Kristen. Regina, you had your hand up. Do you have a question?
I did. We just kind of, she did mention all the open card, but there's also people that are dual covered because their parents have health insurance through a job, and then they're covered by our open card as a secondary. I only heard the Medicare one, so I just wanted to.
That is a good point. Somebody might have a commercial insurance as their primary and OHP is secondary if their family meets the income criteria.
All right. thanks to both of you. So the reason we're talking about this, I kind of didn't preface it very well. The reason we're talking about this is Elizabeth Schmidt is one of our nominees for vice chair. And Elizabeth, am I correct? You have open card?
I'm a dual. I have Medicare and Medicaid through the state.
Okay.
And yeah, so I had the dual. I could explain about it, but I'm not Pacific Source. I never hear from them. They just manage. If Medicare covers it, they cover. So.
Okay.
That's okay. Thank you.
Thank you. Yeah. So the reason we're bringing this to the CAC members now is, so it's an eligibility question. Do we want to broaden the eligibility? Do we want to leave it the way it is, which is a little bit restricted? And my understanding is it would not include somebody with open card. Is that somebody shake their head? Kelly, Michaela? Is that the case? So as it's currently written, Elizabeth would not be eligible to be vice chair. Go ahead, Michaela.
Yeah, so these are the CAC chair and vice chair requirements. And these requirements is something that you, the CAC, created. So you, the CAC, can change these requirements. And so we're looking at one of the requirements is that the CAC chair or vice chair must be specifically a Pacific Source Community Solutions member. So someone enrolled in the CCO and not open card. And so I guess the question to the CAC is, does it matter that the chair or vice chair have to be a consumer representative enrolled in the CCO, or can they be on open card?
I have a quick question.
Go ahead, Teresa.
It seems to me that the only difference is the logistics of how it's paid for. Is that right, Kristen? Is that right?
Well, paid for and managed.
Right.
So for example, like when you brought your concerns about dental, if you had been open card, it would have been just going directly to the state to like file an appeal or grievance, where like with us, it would be handled by us. So we pay out claims, Pacific Source pays out our claims for our CCO members, and the state would pay out claims for like an open card or fee for service member.
Okay, but what the person is dealing with as a patient client seems like it doesn't matter whether you're a CCO or an open card, correct? Like their experiences with doctors and dentists and things like that.
Yes, but where it gets sort of tricky is Pacific Source. If you were to bring a concern directly to Pacific Source, our grievance and appeal department could handle that and follow up with you. Where if somebody was at the state, I don't know if they have a grievance and appeals like team. I might have to ask Rebecca to speak on that. So when you're with a CCO, we're really managing care and looking at provider satisfaction scores and member feedback and experience. And I'm not sure how closely the state is looking at those things.
Okay.
But I don't want to say they're not, because I truly just am not sure.
Okay.
Yeah, so the question before us, that we would need to, finish conversation on first, and then potentially vote on if we want to change this, is do we want to leave it restricted in this way to members of the Coordinated Care Organization, Pacific Source, in our case, who can be eligible to be the chair or the vice chair of the CAC, Community Advisory Council? Or do we want to broaden it to include open card holders, people who participate in that? Any ideas, any thoughts?
So I can see why limiting it to needing to be a Pacific Source member would make sense, because this is supposed to be the Community Advisory Council to the CCO. I would get that, but it was already not a huge number of consumer members. It means that we would be more restricted, and like Elizabeth's voice as a vice chair, I think was so related to so many issues that I would say, I would propose we don't limit ourselves. As long as we have consumer members who are in the Pacific Source CCO, and that would be, things like that would be just making sure that it wasn't all open card folks who couldn't give feedback on Pacific Sources support.
Thanks, Elaine. Any other thoughts or response to Elaine's comment?
I mean, working with the Pacific Source population, we can bring back the same information as a Pacific Source member and an open card member. I'm kind of confused on, as long as maybe the chair is, or somebody on the committee is a Pacific Source member or has a child. I'm not understanding what would be the difference from us bringing the information versus them, if we're working directly with community that is on Pacific Source.
Thanks, Regina. It's hard for me to see all the CAC members without scrolling around, but Mandy, Miranda, oh, thank you. That helped. Stacy, Tom, any other CAC members who would like to comment? You don't have to, but if you'd like to.
Are we working both with Open Card and Pacific Source people? Are we trying to advocate for both those people? Because I'm assuming there's a lot of Open Card in Central Oregon. Or do we want, yeah.
So the CAC is set up to be an advisory board for the CCO for Pacific Source. And the state has rules in place too. So we have to have more than 51% consumer CCO members. So we've been really on sort of the fence with our membership until recently. So the state does have some rules in place that we have to have at least 51% CCO consumers advising on the CAC. So if we were to bring on a bunch of open card members, we would have to offset that with more CCO members. And we know it's hard to recruit people to join this council, unfortunately. So we do need to be aware of that and careful of that. I will say Larry, as the vice chair before, was not a CCO member. But the chair has to be a CCO member. So, or have a dependent enrolled in the CCO. So that's just how the OHA has this set up.
Thanks, Kristen, for clarifying that Larry was open card. Yeah, I didn't actually realize that. So that's good to know. So it's already been done. There's precedent. So maybe that's, I mean, I could just put that out as one possible way to move forward is chair would need to be a CCO member or guardian of dependent who's a CCO member, and whereas the vice chair could be more open, could include really anybody who's a CAC, I mean, who's eligible to be a CAC member could be vice chair. I see some nods. What do you think?
Yeah, so we have 3 other CCOs that we manage throughout the state, and this is actually the only CAC that has a vice chair out of our 4 CCOs. So again, that's not a requirement in place by the OHA that we have to have a vice chair. The requirement is just that the chair. So like you come and represent the board as our consumer member, Brad, and then Linda represents the CAC as a community member. But we have to have a consumer member representing the board. And typically that ends up being the chair.
Okay, thanks. And really, oh, go ahead.
Hey, I have just a little to add that I think might be helpful in this decision as well. One of the strengths of Open Card is that you can travel around the state and use these benefits at any OHP provider. In my past life, we used to see students who would travel to Portland for school and then reside in Bend in the summer. And that would make a lot of sense for them to be in an open card space. So I just want to be mindful, I think, while you're considering this, that if the current person is receiving the bulk of services in Central Oregon, the place where we are impacting the most, that's great. But if you open this up to change the guidelines, you may find someone who is not even seeking services in this region. So it's just a consideration of what, you know, some of the strengths of being open card are from a member perspective, but also then, you know, when we talk about our goal here is to impact change and improve health systems and lives in our region. And that could just be a component that plays in. So I just want you to consider that too.
Thanks, Tricia. So that could just be an add-on, you know, that they'd be utilizing services in our region. Does somebody maybe on staff see a way forward as far as the language? I saw a lot of head shaking. Is anybody opposed to broadening the vice chair eligibility to be to include someone on open card? And it's fine if you are. Now's the time to speak up. And then we could add you know, that detail that Tricia just brought in, which is someone on open card who's utilizing services in Central Oregon. Does that sound like a way forward? Anybody opposed? Not like the idea?
So Brad, I heard that idea. I also heard the idea of at least making that the CAC chair is a CCO member, but not necessarily the vice chair.
Right. Yes. Does everyone support that? Anybody not support that? Speak up now. It really is okay if you don't. All right. So that would, I mean, I guess I've just asked the staff. I mean, that was essentially a vote. I understood that to be a vote. You know, we're shaking your heads, yes, thumbs up, yes. So there's support for that among the CAC members. So the staff can just word that in the way that you understood it, and at the next meeting we can all look at it together just to be absolutely sure. But I don't think it's too complicated, just to change that wording for the vice chair. Okay, so that makes, and again, the reason we were doing all that is to be clear on whether or not Elizabeth Schmidt, who is a nominee, is eligible to be vice chair. And given what the CAC just decided, Elizabeth, you are eligible to be the vice chair. So thanks, everybody. So we do have 3 nominees. Who are our 3 nominees? Elizabeth, who are the other nominees?
Regina and Mandy.
Regina and Mandy. So thanks to the 3 of you for being willing. I'm assuming you're willing. That's all been screened, right? Checked. The 3 of you willing? Mandy, Regina, and Elizabeth? To be vice chairs? Yes, Elizabeth?
Well, from what our conversation is, I don't know that I'm eligible.
Okay, so let's talk about that offline.
I should also clarify, I don't believe that Larry was open card.
Oh, okay.
I think Larry had commercial insurance or something.
So he was more of a community rep,
yes,
not a consumer rep. Okay.
Yes.
Yeah, I can actually tell, I was the vice chair for several years as a community rep, and I stepped down and Larry stepped in after me as a community rep, vice chair.
Michaela, you're gonna say something?
Yeah, and these CAC chair and vice chair roles and responsibilities hasn't been in effect that long, and this is the first time that we're actually using these using this in this new process.
All right. So Regina, we can you can talk with probably Michaela offline.
And just to be clear, I'm just wanting to confirm what I heard was that for the vice chair, we do not have a requirement that the vice chair is a CCO member or a consumer member.
Definitely not a requirement that they be a consumer member of the CCO. But I think beyond that, it's wide open. I think community rep, open card holder, right? Is that everybody else's understanding?
Yeah, why did it change? When did it change, Michaela? I think I missed that.
Last fall, Gwen. You
Yeah,
gotta,
I think when we were developing it, there was some CAC conversation around elevating the voices of consumer members, since they are, the direct lived experience, and our community members and community reps, are very close, but wanting to elevate that firsthand lived experience to those leadership roles.
Okay. So we do need to move on. So Mandy, Regina, and Elizabeth, you three are nominees. We'll figure out between now and January, our January meeting, if you're eligible. We're pretty sure Elizabeth is, pretty positive Mandy is, Regina thinks, not sure. So we'll figure that out. All right. And the vote will actually happen in January. And so the three of you, if you do end up all three being eligible and willing, if you want to just be aware that we're probably going to ask you to say something for a minute or two at that meeting around like why do you want to be vice chair? What are you excited about? Anything you want to say, basically, to support your nomination. Okay. All right. Again, thanks to the three of you for being willing, and we'll revisit that in January. Now we have our challenging decision to make about the additional 61,000 and some change funding that's available for the community health projects. And I'm going to turn it over to Michaela.
yes. So thank you, Brad. Just getting my screen set up. Okay, so yeah, so we have an additional 61,000 of the community health projects funds left over. And so today we'll need to identify, we as in you, the CAC, needs to identify who to invite to complete the full application. So last month you asked to review the previous submitted letters of interest that were submitted and look at the top 5 ranked, as well as the projects that serve those living in Northern Klamath. So you received the summaries. Kelly sent that out a week or so ago. The previous scores when you scored the letters of interest, and then the revised updated scoring to reflect this new focus. And we also asked you to submit your top 3 projects to kind of aid our conversation today. So just a reminder, the letters of interest, those were or are kind of just brief overviews of the project. They aren't the full application with all the details. And the full application is pretty extensive, and it also takes organizations time and staff capacity to complete. And so that's why we're asking you to consider only asking 2 to 3 organizations, or inviting only 2 to 3 organizations to fill out the full application to apply for that $61,000 that we have left over. So, and if we don't have this discussion today, then we'll be at risk for not being able to put money back in the community. We may have misaligned or conflicting opinions when we leave. So we'll do a focused conversation, and that's just a series of questions to kind of build consensus within the group. I do want to share a spreadsheet with you all. All right, so this is the first spreadsheet, and this was sent out, emailed out, as well as mailed out to a few of you. You may want to have this spreadsheet handy, and it has the names of the projects, the organization that submitted the letters of interest, a little short description of that project, a link to the full letters of interest, and at the top, the scoring when the CAC scored these letters of interest back in, I want to say August or September. And then towards the right-hand side shows you how much that project would cost. And then further on, it shows you which areas the project serves. The next spreadsheet, we compiled your results of the survey, and I believe 9 people submitted their top 3 projects that they would like to invite to fill out that whole application. And these are the results. Let me see if I can zoom in a little bit. So on this one, it shows how many, on the left-hand side, it shows how many CAC members voted for that project in their top 3. And then the ranking of it. And you can see, if you look on the left-hand side, it says 5 people included Thrive in their top 3, and then also 5 people included Treehouse Therapies in their top 3 choices. And so I wouldn't rely too much on the ranking, because these 2 tied for first place, first and second. Moving over, project name, amount requested, and then which area the project served that the applicant identified. So questions on anything I went over, or more information that you wanted to add that I may have missed that you think would be helpful for this conversation?
Hey, Michaela, this is Brad. I had a question about I think it was the top 3. Let's see here. There were several that had notes that they have applied for other Health Council funding streams. And so it looks like I'm not sure why I'm not seeing the first page. Here we go. Central Oregon Environmental Center. And it just wasn't clear to me if they were actually applying for the exact same project through those other funding streams. So Central Oregon Environmental Center, for example, says has also applied for improving youth physical activity and impact incentive fund. But did they apply through those 2 for the exact same project, or not necessarily? And then the same is true for neighbor impact. I think that might be it.
So you're looking at the Environmental Center has applied through youth physical activity. I don't, Renee, does someone else know? I don't want to misspeak. Some of these organizations may have applied through the Health Council's impact incentive fund, but even if we approved their impact incentive fund, it would also depend on them getting another external grant. So I don't know that I'd rely too heavily on that.
So from your perspective, that's not that significant that we consider that.
I would say not.
Okay. Okay. Any other questions, comments? I'll give it back to you, Michaela.
And Gwen said it's common for organizations to apply to the Health Council multiple times throughout the years to support existing programs. Okay, so now we're going to dive into our focus conversation. So I want to know from you all, and I'll stop share for a second, which projects excites you the most? And I was thinking that maybe we could go down the list of CAC members to share. So Brad, was there one particular project that excited you the most?
Not exactly. I mean, this is so hard to do because they're all great projects, but for whatever reasons, I kind of landed on I pulled out like the Lifetime Vision Care and I think it's the Treehouse. Let me see here. Lifetime Vision Care only because it's a small budget and it's focused on, underserved, uninsured individuals, and glasses are expensive if you don't have that kind of coverage. And that it's tied to, learning and success in life. And it's $7,200. The other one, Treehouse Therapies, I believe, yeah, because again, it focuses on children with disabilities and children in the foster care system, which are definitely a couple groups of individuals with the odds stacked against them, could use extra resources. Other than that, they're all great projects.
Thanks, Brad. Let's go to Elizabeth.
Hi. Can you hear me?
Yes, we can.
Hello? Yeah, okay. The vision I did and the treetop. And then third was the beef. Those were my top three.
So vision, Lifetime Vision that Brad mentioned, House Therapies that Brad.
Yeah. Yeah.
Project 10.
And for pretty much the reasons Brad gave. I mean, it's a way to get through life. You know, if you didn't have glasses, you really couldn't function. If you need glasses, and that keeps you on the system. Whereas if you have glasses, you can function. And Treetop seemed really good, and it's in both. It looked like various. Oh, it was the northern Klamath up to, I think it was Prineville. I don't know if it was Madras, but it had OT and working through the school system with families so they can get the services. So anyway, I liked them. Okay.
Thanks, Elizabeth. Let's go to Mandy and then Regina.
So my top three were Thrive, COCC, meeting basic needs for their students, and the Neighbor Impact Project.
I don't remember what order. I know Thrive was one of the top. It was my top one, I think. And then I think I was looking at the community health worker one and then the Neighbor Impact. Neighbor Impact has done a lot of work with their food pantry here in Prineville for the last 2 years. And so I'm not sure if this funding would interrupt the services that they provide here in Prineville, but if it did, it's a huge loss for Prineville.
Thanks, Regina.
Can I comment on that? I actually had a meeting with them this morning, and I think they're just looking to expand.
It would be a gain if they have not been present in other areas.
Let's go with Tom and then Teresa.
Okay, I don't remember the order that I indicated. It was Treehouse Therapies was one project I liked. I also, the one that stood out to me the most, not that this was my top ranked one, was the COCC one, connecting students in need to basic resources, because we've been like many organizations have been experiencing difficulty hiring qualified staff for positions that we have. And so I think it's really important to keep, our students moving along and not let something, such as basic needs stop them from getting their education. So anyways, I apologize. I'm having trouble remembering which was my third. There were two that I think I was deciding between. I cannot remember which one exactly I had chose.
That's okay. Teresa? You want to share which ones you liked?
Yeah, I agree with Tom and the COCC college, community college, because I feel like it works towards the future in a significant way. I also looked at Treehouse because I felt like that was very, they're all needed, but that was served rural communities and also really focused on something that was needed and a population that gets lost in the system. So originally I had looked at the other COCC, but it also overlaps with Thrive, and I'm not sure how solvent, not that it's not solvent, but is Thrive getting funds from other places? I'm not really sure. And I like the environmental center because gardens, so that was really the one I landed on, the environmental center. I think that's a really good, authentic way to educate kids in general that crosses the line of and mixes the lines of smart kid, not challenged kid, et cetera, et cetera. And I think you can teach real well 3 R's through authentic experience like that. And they're not asking for a whole lot. So anyway, those were my 3.
Stacy and Miranda, I know you didn't see the applications or the LOIs, but is there any, just want to leave space in case there's something that you wanted to add?
I'm actually familiar with the Treehouse just because I have friends who have used the service. I'm also a part of a mom's group online who there's several people that have used that service and are very thankful for it because their children have difficulties in school with outbursts and things like that, where a lot of people would just label them as difficult or bad children, but they actually have been diagnosed with like, I can't remember, just a defiance disorder. And this Treehouse therapies really works with the kids. And I've heard such positive feedback about it. My best friend is actually having issues, especially after COVID, with one of her youngest sons. And it affects not just the kid, but the family, the school. So that definitely would be my #1 choice. And like Tom said, COCC, supporting our future. I think Tom said that. And I've, again, being a COCC student, I have firsthand experience seeing people struggle, and COCC does a really great job notifying students that funds are available and help is available. So I really like that because that college or COCC does really great, like, hey, if you need help, just click this link, we got you. And then my 3rd one would be the gardening too, or the neighborhood impact pantry. It's really hard. That's all I had to say.
Thanks, Stacy.
Yeah, what Stacey said was great. My first pick was the Treehouse therapy, and then also the CCO for the students. I was kind of in between with the Vision and the Habitat for Humanity, just because Habitat for Humanity is North County, and that's the North County of Klamath, and I know they could use a lot of help. So that's about it.
Thanks, Miranda. Okay. So what values are kind of underlying our thinking? And then we talked about wanting to pick applications or projects that serve rural communities. What other values kind of play into our decision making?
I'll throw one out, Michaela, just size of the institution. Like for me, it may not be fair. It's definitely a bias I have, but COCC is a big institution. They have a lot of ways to get resources to the institution. At least, again, that's a bias. It's an assumption. As compared to Treehouse, which is a relatively small nonprofit, from my understanding. Lifetime Vision Care. I don't know. Is Lifetime Vision Care for profit, nonprofit? I actually don't know that.
Ooh, I don't know that.
Anyways, that's sorry. That's kind of one of the things that I bring into my thinking is generally I think smaller organizations need the support more, bigger organizations need it less. May or may not be true.
Can I throw out something on following that up? A lot of, and I don't know everybody about everything about COCC. I do not claim that, but I do know that some positions and some services rely specifically on grants, and that's why they exist. So, I had the same bias at first. Oh, they're a rich college, but then I started thinking about what services that I know about that they provide, and I know a lot of them are run by annual grants, and so just throw that out there. I would also like to throw out. I would like to look towards building for the future. I mean, I feel like the Treehouse does that, and COC does that instead of just focusing on cope and organize, have food, you're fine, but that's my own bias too. Thank you.
Sure. Looking at size of organizations. What other things should we consider when making this decision?
Gave everybody a chance to say something, but the only other one that I would bring in, which is I can see that apparently I'm the only one who left comments. Those are my comments at the bottom there. Just the size of the actual ask, the size of the project, the size of the amount of resources needed, and again, it's just the way I feel. Funding 3 projects feels better to me than funding 1. Doesn't mean it's the best decision, but nonetheless, that's kind of how my brain's thinking.
So spreading the funds a little bit. Stacy, do you want to comment a little bit more about or expand a little bit more on demographics?
I was just going to clarify that. What I mean is I see that some of these programs are for Warm Springs, Klamath, Jefferson, Cook, and then some are just for like Klamath area. I guess I would be curious to see the saturation and how many people, how broad it is. And is like, if just Klamath area would be able to access the funds, like, are they really desperate in need, or would the money go towards maybe more of the counties? I don't know if that makes sense.
Kind of how broad and who they serve.
Yeah.
What are some of the main points that you're hearing from one another, or some themes?
Just to get our future on track instead of working with people that are already older. I mean, sometimes older people are already set in their own ways, and if we can get our younger generation at a good time, we might create a better path for them. So I don't know. I think that's a big one. I was curious about this one here for funding assistance to attract and skilled counselors. How is $80,000 going to bring in counselors for mental health? What exactly are they trying to do with that? What type of counselor? I mean, you have to go to school for that.
Gwen, would you mind taking a peek at the LOI and seeing if you can see that detail? Stacy says, curve a lot of future mental and physical health problems. So what are some more themes or themes around which projects this group seems to like?
I would just share what I heard, which was a majority of, it's not necessarily a theme, but a pattern of support. The majority of folks mentioned Treehouse. I think that's the organization I heard more than any other across all of us sharing our what we were excited about. CCC was another one. And the mobile pantry seemed to be the other one. I'm not sure actually that there was a majority mobile pantry, but CCC and Treehouse were the two that I heard multiple people mention.
So Treehouse and COCC and Vision.
I think everybody was talking about the first CCC on this list, right? Or connecting students to resources, or was it the other one? That actually wasn't clear to me. When people were talking about CCC, which CCC were you?
Yeah, there's two in there. I think one of them was for community health workers too, like to get people out there to advocate for people to get them on track.
Stacy said the basic needs one. Anyways, yeah, that wasn't clear to me.
Right. Good point. So the first one, paving the path to healthier communities or connecting COCC students. Stacy, which one did you like?
I was talking about the one for basic needs.
Connecting?
Yeah, connecting students.
Regina, did you say that you liked?
Well, I mean, I do like that one in a way because, you know, with our CHWs and people learning and training to help our community, it's just, it just brings it back to the type of work that I do and that I have a passion for. And that's, you know, if that opens up more doors to have that peer support for our young people, or even our, you know, adults that are out there to help out. I mean, I think it's a great resource. I mean, but I think the one I voted for was the community college one. The students to access stability and housing, because I mean, how could they go to school if they, you know, they don't have that support?
So the connecting one?
Yeah, both of them are good, but I'm going for the second one on the list.
And Mandy had said me too to that one, I believe.
Okay.
She was talking about the basic resources one.
Okay.
In the chat.
So it sounds like Treehouse and COCC, the connecting COCC students to need to basic resources. Students in need to basic resources. So with that, so the connecting COCC connecting is 51 and Treehouse is 45. I'm hearing strong support for those two. Did you want to invite a third?
Well, the other one that's top on the list is Thrive, and Thrive is actually intertwined with this community college one too. And they're providing similar resources. And I feel like Thrive also gets money from other areas to fund so much stuff.
Thoughts on that?
Regina, it wasn't clear to me. Are you suggesting that we include Thrive as a third, or?
No, not necessarily. I mean, it is top on the list, but if you look at their, you know, they're intertwined with this one that we're all voting for.
Right.
And I'm pretty sure the Thrive does provide a lot, you know, for our areas. But I'm pretty sure they get funding from another source as well to be able to provide as much services as they do.
Stacy says agreed.
So there's nothing, I mean, we can just invite the two, correct? As
Yeah.
opposed to inviting three?
This group can invite the two. So since these organizations submitted their letters of interest back over the summer, things may have changed between now and then. So even if we invite two, there could be a chance that only one of them would actually apply and fill out the full application. With time passing.
How does everybody feel about that? Inviting the Treehouse Therapies and Central Oregon's Community College, connecting CCC students to basic needs. Yeah. Teresa, thumbs up.
Is that how you want us to tell?
Yeah, speak up, thumbs up.
Michaela, what's our timeline on this?
Yeah, so we'll send out the applicants today. See if they're still interested in applying, and then we'll give them till February 1st to complete that full application. And then at your February meeting, you CAC members will make that decision on funding.
Okay.
Anybody opposed to moving forward with inviting those two organizations to submit a full application? The rest would be essentially dropped off. Thanks for their applications and sorry. Yeah. No one's opposed. Okay. It sounds like a approval. Thanks, Michaela. Thanks, everybody. Nine of us giving input. That's awesome. That's fantastic. I think that's everyone. Or is that not everyone? How many CAC members are there? No?
We have 16 now.
16?
Mhm.
Oh, well. I guess I'm just thinking of consumer reps. Well, that's still pretty good. Not great, but pretty good. So thanks to everybody who gave input. So we are basically out of time. The last item on our agenda was to get feedback from Rebecca and Kristen on our periodontal care emerging issue. We can either agree to stay together for another 5 minutes and give them that opportunity, or we can push it to the next meeting. What do people?
So to give folks a little teaser, is that Rebecca and Kristen have proposed a potential action with regards to the periodontal care emerging issue. They're going to introduce the idea, and it'll probably be a conversation beyond the introduction of the idea to see if, one, it's something you want to do, and two, how you'd like it to look to be able to reach, the outcomes, soft or hard outcomes that you're looking for. So we could, if you want to hang on for 5 minutes, if that's enough, Kristen, to kind of introduce you to the idea, and then we'll probably need to come back together to have, to really explore it a little bit more and for you to be able to ask questions, or we can take it all on in January.
Is that enough time, Kristen, to give a brief? I got 2 people in the chat said 5 minutes is okay. We have 5 minutes.
I think Rebecca and I can pitch it in just a few minutes. So what we'd like to propose is to have basically a DCO or dental care organization panel. And we would ask representatives, we have 3 DCOs, so we would ask for representatives from each DCO to come to a CAC meeting and just give a super brief overview of the DCO and then hear your concerns, answer your questions. Rebecca, if you want to jump in about.
Sure. Yeah, and so behind the scenes, Kristen and Trisha and I have been having conversations with the DCOs, with Heather Simmons, who's the dental care coordinator at Pacific Source, and I've been having conversations with the state dental director. And so we've come up with this idea of this panel discussion. I will say I spoke with Dr. Raffia, who's the state dental director, last week, and he's very interested in attending if the CAC decides to move forward with the panel discussion, either participating on the panel or just being there to interact with the CAC and answer questions as well. So I think we have a lot of interest from the DCOs in being able to have a conversation with the CAC, specifically around the periodontal issues that were raised, but also more broadly, any questions related to dental. The question that Regina brought up today, accessing services, how many providers of different types of providers are in the network, and how does that work? Care coordination, how do I get connected to a care coordinator, or how do I get my questions answered? All of those types of things.
Thank you, Kristen and Rebecca. What does everybody think? It sounds like a good idea.
I want to just add on some of the conversations that staff have had with Kristen and Rebecca. Is it's as much about you all receiving some information as inviting the DCOs into a broader conversation to look at the breaks in the system that y'all are experiencing, and be able to have a warm, welcoming, and challenging conversation to move things forward, or just highlight some of the experiences you're having and help stimulate their work internally as well. So
yeah, thank you, Gwen. That's exactly the goal.
Regina?
I just have a curious question for Kristen and Rebecca. So how do you guys determine who's assigned to who for their DCO? Because that's again, that pulls it back, like the children can't access that care because they're too young, or that their providers where they're assigned to don't accept the children at that age because they can't handle them. How do you guys assign those?
That's randomly assigned when somebody is enrolled in the CCO, but you can call our customer service department and we're happy to change the DCO that any member is assigned to. So for example, we had a new provider sign a contract with the Warm Springs Health and Wellness Center, but they were only able to accept ODS. So we then at Pacific Source side changed about 25 children from whoever their DCO was before to ODS. So they were all able to see that new provider.
Yeah, I understand the process on how to change.
Oh, okay.
But do our parents don't. And so that's where that hang up is again. Like if there was a better way to assign a DCO to a child, we might not have that problem.
So I'm so glad you brought this up, Regina, because this was part of the conversation that I had with the dental director, the state dental director, Dr. Raffia, last week. He brought it up. He said, Rebecca, he's new. He started relatively recently within the Oregon Health Authority. And he said he was shocked to find out that families were sometimes being split in the assignments of DCOs, and that doesn't make any sense. And so I think there will be acknowledgement that there are flaws in the system. And I think particularly, I know Dr. Raffia wants to hear directly from all of you exactly what you're hearing in the community, seeing in the community, your experiences, to really help cement the awareness, to think about where to target issues that we're hearing about within communities, and to engage the DCOs and the CCOs in the conversation. I think it's an opportunity to have a really powerful conversation, acknowledging as Gwen said, those gaps in the system that are really impacting families. And so I don't think it's to gloss over or just sugarcoat or to say everything's working great. Here we are, the dental care organizations. It's really to get at some of these tough issues that you've all been raising.
Okay, thank you. Yeah, that's the main one, navigation of it, not knowing where to start and who they're assigned to.
So what we'd like to do is next month, really, if this is something that you want to move forward with, is have a robust conversation with you and almost planning that and getting your heads wrapped around what this would be, power dynamics, assumptions, hoped outcomes, approaches, those kinds of things. But I also want to give you a time to consider, is this even an avenue that you want to go to? We can, well, if folks are strongly, yes, absolutely, or maybe I want to think, we could, bring this back in January, just for even deciding to move forward.
What do you think? You love the idea? Hate the idea?
Do we have a 5 finger?
Yeah, let's do the 5 finger. Thank you, Teresa. Let's do the 5 fingers. Yes. Elizabeth's on the phone. Elizabeth, you can shout out your number.
What'd you say? No, Brad?
We're doing a 5 finger vote on if you like the idea. How much do you like the idea to coordinate a panel discussion with the dental care organizations representatives?
Okay. Yeah, I've been listening. Yeah, I'm 5 on that. Yeah, I'm for it.
All right.
Tom, I'm not.
Thank you.
Did you show fingers, Tom, or throw something in the chat? Okay. Thanks. All right, I'm seeing everybody else.
This is in January. They have to talk for me, okay? Because I'm gone in January.
Yeah. This will be, Gwen, this will be like February, March, right? It's going to take some time to plan. And
Yeah,
Okay.
we'll
Okay.
have internal conversations probably over the next couple of months. We need to probably book time with the DCOs now for a couple months down the road because, schedules.
Yeah, fantastic.
I think, yay, you guys. I think it's critical that everybody has a sense of what other people are doing, because I have found total ignorance, just ignorance, because their jobs are too big. Nobody knows what anybody else is doing. And that's half the problem of patients being circled around here and there. So yay, I'm so grateful to you too.
Thanks, everybody. We are now over our 5-minute extension. So great work. I think we did great work. Fantastic job, everyone. Thanks for all your input and moving us forward.
Lovely holiday, all.
Thank you. Happy holidays.
Be well.